Your ED narrator. This is where you will chart the majority of your patient's visit. You can see that your triage stuff is already there that you've done already. If you needed to go back and change some stuff, like I had an interpreter or anything like that, you can go in and chart that. This ED required info, this is stuff that we have to chart on all of our patients, so you might as well click it, and you can click it from over here too. This is your essential documentation. So this is everything you need to chart on your patients. So as long as this list is here, that's what you need to keep completing. So if you put an allergy band on, if any of these things are not applicable, what did I use to identify my patient for their band? Usually their name and birth date. I put their ID band was on, their call light was in reach. This is kind of your regular rounding, rails up, any weapons, who told you the information. This ASQ, so you'll hear ASQ a lot, ask suicide screening questions. This is our new Columbia suicide score. So you'll see this on every patient. This is a change. We're going to have to ask every patient that's alert or semi-alert these questions. If they answer, we have a flow sheet you'll get out that you'll see. If they've ever done any of this in the last year, that's really what they care about. If they answer positive to any of these things, then the crisis worker will evaluate, or at least they'll at least look in the chart and screen the patient. So this calculates as a potential risk patient. So that's when we need to talk to the provider. We need to decide what we're going to do with that patient. Right now we have the Morse false risk. We are probably going to change that back to our other one. So just so you know, that's what we got right now. It'll calculate it for you. And yeah, we have to do a skin assessment on our patients too. But you can do those pretty quick on most of our patients. Living arrangements. And you'll learn all these little quick things. We did our dry erase board, no other needs except, and then these things up at saying, yep, patient screened as potential risk, behavioral team has been notified the provider, consider ordering suicide precautions and safety trays. You can go right from here and we can order it. And so it pops up this order. So this is already the order. So I can do it right from there. No, sorry, wrong spot. So this is a cosine. And right now you have to delete this information here, and then it'll find your patient, your provider. So, but it lets you quick go in there and order that real quick. And then you can click this arrow and it'll get you back to your bigger screen. So it's now, see, my essential documentation is just down to assessment. So what kind of assessment? I'm going to do a simple initial assessment. That's all I want to do. Okay. And so then I go over here to my assessment, and what things do I want to do on this patient? I want to do musculoskeletal because her thing was arm pain. So this is normal. If you want not normal, just do this. Right arm. Yep. Right arm. Sorry, have to do them separate. There you go. CMS is intact. And you can add more sites if you want. That's really quick. General information on this patient. And we already did, oh, it didn't, I did that already, but you typically when you do this the first time it'll take it over, and I don't know why it didn't in here. It's probably just because we're a playground, but it usually takes it through. Okay, and so that is all of your required information.